Hi guys, it's Don. Welcome back. Last week I had a conversation with April Mativier, our COO here at Mountain. And she and I were discussing healthcare in America and my thoughts on the future. So what I'd like you to do is think about the future for a moment. As I record this, it is November 2010. Let's look forward to November 2014. That's the first year that healthcare reform policies should be enacted. And imagine for a moment, if you will, the sound of ringing telephones. Ringing and ringing and ringing. That's the sound that many family practice offices are going to be hearing more and more and more. They're probably going to have to hire extra staff to be able to handle all the calls. Because as we look at millions of patients coming into the system, I've talked in a couple of blogs before about who's going to take care of them. Well, I think one of the ways, and I'm starting to see it more recently, is, and I'm going to call it the retailization of healthcare in America. And that's the retail clinics that are popping up in Rite Aids and Walgreens and CVS and Walmart and a number of other facilities. I apologize to those who I missed. But those are the major players in the market right now. I've been reading a lot about the quality of healthcare. We've actually staffed quite a few of the Walmart facilities here in Maine. But one of the big ones I noticed last week was the buyout of Concentra by Humana. Now let's look at that for a moment. Humana is a large insurance carrier. Humana buys Concentra to get access to their 300 plus urgent care centers around the country. Humana also just created a new program with Walmart for a preferred prescription drug plan. So in a local community, you've got the insurer Humana sending their patients to Concentra location. Concentra location gives a prescription. They obviously direct them to a Walmart. I think we're going to see more and more of this as we go forward, of either insurance carriers looking for a new revenue stream, because obviously they're going to be limited in what they're going to be able to charge going forward, and teaming up with companies such as Concentra, buying them out to be able to get access to their clinics. And again, I call it a retailization of healthcare. I think we're going to see more and more of that as we go forward. I'm not saying the care is better or worse, but what I am saying is it does make sense to look at the situation as a whole instead of individual pieces. If someone goes into a Walmart clinic or Ready Care, Minute Clinic, Ready Clinic, that clinic is only going to see that one ailment of the person. I think that everyone eventually is going to need to have a primary care doc to be able to take care of their personal needs, looking at the big picture. Something could be missed. If someone goes to a Walmart clinic and then they go to a Minute Clinic for two different ailments, it could be part of a larger problem, but the two clinics aren't going to talk to each other, so no one's going to be looking at that person's overall well-being, which I think that's why it's important. So I think for hospitals and large providers to continue to start looking at family practice options and their primary care services to see where they're going to need to expand, as I think they are. But just want to talk a little bit about that. Would again always welcome your feedback and your comments. Would love to hear from anyone who has a differing opinion or who agrees with me. All right, have a great day, and we'll talk again soon. Take care. Bye-bye.